The current problem with HIV infection is that the virus enters into the body's cells, but the antiretrovirals don't actually kill it. The virus stays in the cells for a long time. The current objective is therefore to attack the infected cells, either to achieve remission from HIV infection or to eradicate the infected cells. For remission, you have to greatly reduce the number of infected cells so that the patient's body is able to control the infection. To achieve eradication, all the affected cells in the patient's body need to be eliminated. Today, the advent of eradication strategy remains a long way off, much further than the successful strategy of remission. In order to successfully reduce the reservoir of infected cells, we're tackling the problem of differentiating between infected and healthy cells. We need to find specific biological markers on the infected cells to be able to identify them. Another option would be to reactivate the virus in order to identify it in the cells and then destroy it. So we need effective immune responses which could be developed thanks to work on a vaccine. During the past few years, there's been impressive progress in this field. Even though we don't have an available vaccine yet, we now know the characteristics of the immune responses that we need to develop. We need to optimize an adapted strategy to provoke these now well-understood immune responses. There are promising preliminary results in animal models.
The vast majority of HIV-infected children are infected either during birth or around the time of the birth, mother-to-child transmission. The problem is that these very young children need to be treated as quickly as possible. Without treatment, nearly half of these children won't see their second birthday. The WHO recommends treating these children as early as possible, to diagnose the children as soon as possible after birth. The problem is that the products that are available are poorly adapted for children. Some of the syrups are toxic, some aren't stable at high temperatures, some are difficult for the mother to administer because she has to give a certain number of milliliters of one syrup, less of another, and more of yet another. It's obviously quite difficult for the mother. So the recommendations are excellent, but they're almost impossible to implement properly. DNDi's mission is to resolve exactly this problem by combining the necessary different medications into a single product, to avoid syrups, to have a solid formulation, and something that masks the taste, because one of the drugs tastes terrible. It's a daily battle for the mother to give it to her child.